21 emergency medical officers have been struck off the register by the Health Professions Council of South Africa. The Limpopo Health Department was informed by the council after the employees failed to meet the required standards to remain active members of the council. The Provincial Health Department says it was left with no choice but to terminate their employment. Let's get the latest now from Limpopo Health Department Deputy Director General Matume Mawasha. Mr. Mawasha, thank you so much for joining us this morning. A very good morning to you. I mean, to lead to the 21 emergency medical officers having to be dismissed simply because they were not meeting the requirements and standards. The question then begs to be, how long were they working, as emergency practitioners before this was actually highlighted? How long had they been at the job without the necessary qualifications?
Good morning, and good morning to your viewers. These people would have been appointed at different times, so they would have been in the department for various lengths, and it's not easy to say they were employed for this long. Some would be a year, 2 years or so. So that's what it is. But it doesn't say for all this time that they were there, they were not registered. Registration needs to be renewed. The councils must satisfy themselves that a person or a professional remains fit and proper to practice their craft. So registration is renewed on a regular basis.
How regular is regular then?
Annually, and with other professionals it will differ, but it is generally annually. We have various professionals. We have doctors, we have pharmacists, we have these lot, that is your emergency medical services officers. So generally it is annually. So they failed to ensure that they remain so registered, and we don't have an option. It is not the desire of the department to lay off the workers. That is why we send them letters to say, produce the certificate, which would then give them the opportunity to get their matters right with the council. If they do that before the time we allow them, then they will continue to be in our employ. So it's our hands are tied, really. It is not so much our wish or desire for them to be at home. But we duty bound.
Just to get clarity here, for the Health Professions Council of South Africa to actually register medical practitioners or emergency medical officers into the system, they have to meet certain standard recommendations, whether or not they are fit to do the job, the necessary, whether they're mentally fit, physically fit, and the like. So there's a certain qualification criteria that clearly in this case here has not been met. That's why some of them were not actually registered. They were deregistered because they did not meet the standards and the criteria. I guess then the question also on the other side of it, as much as employees are being laid off as well, Matume, on the other side, it's how long had employees who were not fit, and according to the Health Professions Council of South Africa, were not fit to do the job. How long had they been doing the job? And why is it that sometimes it takes a long time to be able to detect whether or not somebody's fit to do the job? One side is an employee being lost, but if an employee is not fit to do a job, that employee becomes a hazard, I think, to any form of department.
In this case, we're not necessarily saying those people are not fit. You must present yourself. You must go through some processes to maintain your registration. So if you do not go through the admin processes with the council and lodge your papers there, obviously the council will not consider you, and to a point where the council could scrap you. I don't want to speak so much for the council, but I do know that in this instance, we're not necessarily saying these people have been unfit or something like that. It's just a matter of paying your dues and ensuring that your paperwork is at the council and you stay registered. So it is not as if there are people who put themselves across and then failed to meet the requirement. It's more about not even presenting yourself, not even getting your documentation proper. We could have had fit and proper people, but they did not do what they ought to have done, which is at an appropriate time, present yourself to council. It does not necessarily mean that we had unfit and improper people rendering services. So the council need to remain satisfying themselves, or therefore a person must present themselves to them.
Yeah, but of course, if they even did not present themselves, then in itself, that action becomes questionable, doesn't it? If you know that you're supposed to do something and fulfill an administrative mandate in order for you to be considered within a medical field, and given the severity and the seriousness of this particular profession, I mean, this particular profession is quite sensitive, and that does not get met in itself, that also is a fault. That's not something that should be done in any instance. But I can imagine now that the Limpopo Health Department is feeling the pressure, especially when it comes to emergency responses. How are you guys handling the pressure that's now been added as a result of this 21 being laid off?
Okay, the 21 would be distributed across the various stations. So it is not 21 impacting on the particular EMS station. That is the first thing to take note of. So it may be in one station, 1 or 2 people, in another 1 or 2 people. So if you look at our total number of employees, 1,940, thereabouts, the impact is really very small. And we've always had contingency plans, a comprehensive contingency plan across the province for the festive period, working together with the traffic department, the police and everybody. We've been every year putting out a plan to mitigate the impact of the busy season on our services. So it should not be a problem at all. It will include quite a number of things, overtime being performed. It would include, improved deployments. Let me say increased deployment of resources of various kinds at hotspots and so on and so forth. So it is a plan that we've implemented all the years. We're not foreseeing any problem, even in this year, in spite of this.
All right, but is it not true also that we've got about 46 or so emergency medical officers that have also been requested to provide proof of registration to the very same Health Professions Council of South Africa? And this is outside, of course, of the 21.
It is true. Remember, I'm saying and for the very reason you are stating, not for us, for the department not to take risks, we are doing what we have to do. It's not what we want to do. So when an audit was done and it was found these individuals also did not present themselves and get their papers in order, we have no option but to write to them to request them to produce the papers. That means they may or may not be able to do so, in which case we can't allow them to work. It's not what we want, but it's just what it is. We are duty bound. We can't allow a person that's not registered, be it a doctor, be it a nurse. And this is not a new thing. It happens regularly in the department. We do the audits ourselves. Sometimes the council does, it audits itself, so that we at all times have people that are fit and proper, but also that have been properly certified.
Yeah, very quickly, Deputy Director General, I have to, before I let you go, when was the last time that the Limpopo Health Department provided and did an audit?
This audit, I think, was done 2 weeks ago. I'm not too sure of the exact date, 2 or 3 weeks ago.
And this was done by the Health Department?
Yes. Like I say, sometimes it is us, and there are times that the council will also come forward and do the audit. We also have the Office of the Health Standards and Compliance, which is an entity of the National Department of Health that would also do these audits of various kinds to see that our departments perform at the correct standards in all respects. So indeed, yes.
We have to leave it there for this morning. Limpopo Health Department Deputy Director General, thank you so much for your time. Madume Mawasha.